Hello, I'm Dr. Tim McLerran, and I'm really pleased to be with you again on this Autoimmune Hemolytic Anemia Day. Thank you to Karen Jones for inviting me back this year. Last year, I discussed artificial intelligence in the healthcare space, and I spent a lot of time thinking about the history and talking about the history of AI and how we've sort of gotten to where we are now and what is AI. This year, I'd like to share with you where I see things going. And there have been some really interesting advancements over the course of this past year. One of the really critical things that I think has happened since the last time we spoke is the artificial intelligence that is sort of the top tier artificial intelligence that's out there right now has gotten better than human physicians at clinical reasoning and clinical knowledge on sort of an average basis. I started to realize this when I was testing and developing and testing a way to look across all the patient cases in a population and find which patients have the most modifiable risk factors that we can intervene on to help those patients get better, so that we can focus our resources on the patients who will benefit the most. And as I was doing that, I was asking the artificial intelligence to give me a sort of a chain of thought reasoning through a patient's case, and I was able to see in that reasoning that the AI understands the patient very well. It's only limited by what it's told, really, or mainly limited by what it's told. But if it's given good inputs, then it will give good outputs. It will understand a patient well and be able to make appropriate decisions about a patient's care. So, and another really important thing that's happened over the past year is that we've given artificial intelligence now the ability to speak with a person in a natural kind of conversation, and not just through text, as many of us have become accustomed to with ChatGPT, but now voice to voice. You can just talk to it like, have a conversation on a phone. And so putting these two pieces together, I realized that we have the building blocks now to make a fully autonomous healthcare system. So I wanted to see what would that look like if we had a fully autonomous healthcare system. So today what I'm going to share with you is an example of that. I'm going to play myself, except that in this scenario, I'm going to have a rare disease, and I'm going to call into this autonomous healthcare system looking for help. And it's going to walk me through several stages of a workup, and then giving me a plan to help me deal with my problem. So that's what I'm going to share with you today. I'm really excited about it because it actually works. Everything you see today, when the AI is talking, that's actual AI. It's not me scripting this. And the AI is coming up with the questions, the assessment, the plan. I just told it how to conduct a good medical interview, and let it go, and this is what happens. And so it really comes down to, like, can we take this incredible intelligence that we've created now, and can we hook it into our healthcare systems in ways that can maximize its potential, to provide better care to patients sooner. Just imagine a world where you're able to pick up the phone at any time of day or night and get physician-level attention. And not just any physician, but a physician who is board certified in every specialty. that level of attention. And you can take as long as you want to tell your story. There's no feeling of needing to rush. And then that system is able to communicate with laboratories and pharmacies to put in orders and to help you get the care you need. As soon as orders come back from the lab, it immediately analyzes them and then can call you back right away with those results and the assessment. And so you are able to very quickly progress through a workup that might have otherwise taken months. And that's what you'll see today. So I'm really excited to share this with you. And thank you again, Karen, for inviting me to speak.
Hello, this is Samuel, an automated clinical assistant working with Constellation Health. How can I assist you today?
Hey, um, I guess I've been having some issues with my health, and I just wanted to try to figure them out. Yeah, I can tell you about it if you want.
Thank you for reaching out. Before we begin, I want to let you know that this is not an emergency line. If you're experiencing a medical emergency, please hang up and seek immediate care. Could you please start by telling me your name?
Um, yeah, I'm Tim McLerran.
Thank you, Tim. It's nice to meet you. Could you tell me a bit more about the health issues you've been experiencing? What's been going on?
Um, I've been feeling like really tired and run down. Ever since like Christmas time. Um, it's been a couple of months, and it's just it's like kind of worse over time. It's
I
to the
understand.
point now where like I get up to the top of the stairs and I'm like kind of winded and my heart's racing, which is weird for me. Like I've been a pretty athletic person throughout life, and to be able to get like so winded just going up the stairs, it's not right. It's not me. Um,
Thank you for
yeah, and
sharing.
I just feel like I've just been kind of pale and not myself. In fact, people have been telling me like you look kind of pale, like I mean, which is saying something for me because I'm pretty light skinned anyway.
Thank you for sharing that, Tim. It sounds like you're dealing with some significant fatigue, shortness of breath, and changes in your appearance, like looking paler than usual. Have you tried anything so far to manage these symptoms, or has anything seemed to help or make it worse?
Um, I I've got two young kids and two dogs, and I have to like function in life, you know, I have to take them out and stuff and chase my toddler around. But it's just gotten a lot harder, so I've just been sitting down more, honestly, and resting more wherever I can. Um, yeah,
It,
nothing really seems to help though. I mean, if I rest now, it's not like I can get up and 10 minutes later and I still feel like kind of weak.
got it, Tim. So even with resting, you're not feeling much improvement, and it sounds like this is really affecting your daily life. Just to make sure I understand, you're dealing with fatigue, shortness of breath, a racing heart after activity, and feeling pale or weak. And these symptoms have been gradually worsening since around Christmas. Does that sound accurate, or is there anything you'd like to add or correct? Before we wrap up, is there anything else you think is important to mention that we haven't discussed yet?
No, I think we kind of hit everything. Um, yeah, I'm just trying to figure out what's going on. So what's yeah, where do we go from here?
Thank you, Tim, for sharing all of this information. I know it's a lot to process, but you've done a great job giving a clear picture of what's been going on. I'll make sure all of this is reviewed by the medical team. Here's what happens next. The medical team will carefully go over the details you've provided, and you can expect a follow up call within 48 hours. If they need any additional clarification, they may reach out sooner. Does that timeline work for you?
Yeah, yeah, that sounds good. Hello, this is Tim.
Hello, Tim. This is Samuel, the automated clinical assistant you spoke with during your last call. I want to remind you that this is a non emergency line, and this call will be recorded for quality and care purposes. Do I have your consent to proceed?
Yes, please.
Thank you. Thank you, Tim. I'm calling to check in on you and to discuss the assessment and recommendations from the clinical team. Before we get into that, how have things been going since we last spoke? Have there been any changes or anything new you'd like to share?
No, everything's the same.
Got it, Tim. Thank you for letting me know. Before we move forward, do you have any questions or concerns you'd like to address before I share the assessment from the clinical team?
No, I'm just really curious to hear what they have to say.
Understood, Tim. I'll walk you through the assessment step by step. Based on the information you provided, the clinical team believes your symptoms, such as fatigue, shortness of breath, racing heart, pallor, dark urine, and the yellowish tint in your eyes, may be related to an issue with your red blood cells or possibly your liver. This could involve something like anemia, where your body might not have enough healthy red blood cells, or a process where red blood cells are being broken down too quickly. Another possibility is that your liver might not be functioning properly, which can also cause some of the symptoms you're experiencing. Does that make sense so far? Would you like me to explain anything in more detail?
Um, okay, that's a lot to take in all at once, but um, so could be an issue with my blood, my red blood cells, or my liver, you're saying?
Yes, that's correct, Tim. The clinical team is considering that your symptoms might be caused by an issue with your red blood cells like anemia, where your body doesn't have enough healthy red blood cells, or a process where they're being broken down too quickly. Alternatively, it could involve your liver, which plays a role in processing substances in your blood, and if it's not functioning properly, it could explain some of your symptoms, like the yellowish tint in your eyes and dark urine. I know this is a lot to process, so please take your time. Do you have any questions about this so far?
Okay, so it sounds like we aren't quite sure yet what it is.
That's exactly right, Tim. At this
So,
point, we don't
so
have a
what do we need to do to, sorry, so like, what do we need to do to figure it out?
great question, Tim. To figure this out, the clinical team recommends starting with some lab tests. These tests will help us understand what's happening with your red blood cells, your liver, and other key systems in your body. Specifically, we'd like to check your blood counts, liver function, and markers that can indicate if your red blood cells are being broken down too quickly. We'd also like to analyze your urine to gather more information. Does that sound okay to you? Would you like me to explain any of these tests in more detail?
So that's it, I just need to go get some labs done?
Yes, that's it for now, Tim. The next step is to get the lab tests done. Once the results come back, the clinical team will review them and determine what's going on and what steps to take next. We'll keep you updated every step of the way. Does that sound good to you?
Um, okay. Yeah, I mean, like, how bad could this, whatever it is, be? I mean, do we like know specifically what might be going on? Am I gonna die? Like, are these the kinds of things where I have like just days or months to live, or is this like, oh no, we can just give you an antibiotic and send you home? Like, how bad is it?
Tim, I completely understand why you're feeling worried, and I want to reassure you that it's okay to ask these questions. Right now, we don't have enough information to say exactly what's going on or how serious it might be. The symptoms you're experiencing could be caused by a range of conditions. Some are more serious, while others are treatable and manageable with the right care. The good news is that you've taken the right step by reaching out, and we're moving quickly to figure this out. The lab tests will give us a much clearer picture, and once we have those results, we'll be able to provide you with more specific answers and a plan. I know it's hard not to worry, but please know that we're here to support you through this. Does that help ease your mind a little?
Um, yeah, I mean, I don't know. I guess I've been worrying in the back of my head this whole time, and um, now that I've like gotten it out and we're like starting into the process. It's just like, I don't know, I'm nervous, um, but at least we're doing something. So, okay, let's just give those lab tests and see what happens.
That's exactly right, Tim. It's completely normal to feel nervous, but you're absolutely doing the right thing by taking action. These lab tests are the first step, and they'll give us the information we need to figure out what's going on and how to address it. You're not alone in this. We're here to guide you every step of the way. I'll make sure the orders are sent to the lab, and you'll get a confirmation shortly with all the details. Once the results come back, we'll review them and follow up with you to discuss the next steps. Before we finish, is there anything else on your mind or any other questions you'd like to ask?
Hello, this is Tim.
Hello, Tim. This is Samuel, the automated clinical assistant you spoke with previously. I am calling to check in on you and discuss the assessment and recommendations from the clinical team. Before we begin, I want to remind you that this is a non-emergency line and that this call will be recorded for quality and documentation purposes. Do I have your consent to proceed?
Yes.
Thank you, Tim. I'm glad to hear from you. I'd like to start by checking in how have things been going for you since our last call. Have you noticed any changes or had any new concerns?
I went to the lab and did the tests, and I think I've just continued to get more tired and feel like more yellow. Um,
Thank you for letting me know, Tim.
uh,
I'm sorry to
and
hear that you're feeling more tired and noticing more yellowing. I'll make sure to share that with the clinical team. Before we move on, do you have any questions or concerns you'd like to discuss about how you've been feeling or the process so far?
no, I just really want to know what the lab tests showed.
I completely understand, Tim. Let me walk you through what the clinical team has found so far. Based on the lab results, it appears that your symptoms are likely due to a condition called hemolytic anemia. This means that your red blood cells are being broken down faster than your body can replace them. This breakdown is likely contributing to your fatigue, pallor, and the yellowing of your eyes, scleral icterus, as well as the dark urine. This is a significant finding, but it's important to know that we're on the right track to understanding what's going on. There are still some additional steps we need to take to confirm the exact cause of the hemolysis and determine the best treatment plan for you. How are you feeling about this so far? Would you like me to explain anything in more detail?
Um, like how bad is this? Am I
That's a very understandable question, Tim. Hemolytic anemia can range in severity depending on the underlying cause and how quickly it's addressed. Right now, your hemoglobin level is quite low, which explains why you're feeling so tired and short of breath. While this is concerning, the good news is that we've identified the issue and can now focus on finding the exact cause and starting treatment. The next steps will help us determine whether this is something like an autoimmune condition, a hereditary issue, or another cause. Once we know more, we can create a plan to manage it effectively. It's important to take things one step at a time, and you've already taken a big step by getting the lab work done. Does that help answer your question, or is there anything else you'd like to know? Take your time, Tim.
um
Let me know if you have any other questions or concerns, or if you'd like me to explain anything further.
yeah, so is this should I like go to the hospital, or um am I like in any immediate, I mean, this has been like kind of a few months process, but am I in any like immediate danger here?
That's a very important question, Tim, and I want to reassure you that we're carefully monitoring your situation. Based on the lab results and your symptoms, this is something that needs to be addressed promptly, but it doesn't necessarily mean you're in immediate danger right now. However, if you start to feel significantly worse, like if you experience severe shortness of breath, chest pain, confusion, or fainting, you should go to the hospital right away. The clinical team is working to determine the next steps, which may include additional testing or treatment to stabilize your condition. For now, it's important to rest, stay hydrated, and avoid strenuous activity. We'll guide you through this process and make sure you get the care you need. Does that help ease your concerns a bit? Let me know if you'd like me to clarify anything further.
Hello, this is Tim.
Hello, Tim. This is Samuel, the automated clinical assistant you spoke with during your last call. I hope you're doing well today. Before we proceed, I want to remind you that this is a non-emergency line and the call will be recorded for quality and training purposes. Do I have your consent to continue with the call?
Yes, please.
Great, thank you. I'm calling to check in on you and discuss the assessment and recommendations from the clinical team. We'll work together to agree on a plan that will be practical for you. Before we get into that, how have things been going since our last call? Do you have any questions or concerns you'd like to discuss?
No, I went and did the tests that you guys ordered. Yeah, I'm just really eager to find out what happened or what was the result.
Thank you for sharing that, Tim. Let's go over the assessment based on your recent test results. The clinical team has determined that you have a condition called warm autoimmune hemolytic anemia, AIHA. This means that your immune system is mistakenly attacking your red blood cells, leading to anemia. I understand this might be a lot to take in. Do you have any questions about this diagnosis so far?
My immune system is attacking my red blood cells.
Yes, that's
Um,
correct, Tim. In warm autoimmune hemolytic anemia, your immune system produces antibodies that mistakenly target and destroy your red blood cells. This is why you've been experiencing symptoms like fatigue, shortness of breath, jaundice, and dark urinates, all related to the loss of red blood cells and the breakdown products from that process. How are you feeling about this information? Do you have any questions or concerns you'd like me to address?
um, gosh, yeah, how bad is it? Like, is this treatable? Am I gonna die?
Tim, I understand how overwhelming this must feel, and I want to reassure you that this condition is treatable. While it is serious and requires prompt attention, many people with warm autoimmune hemolytic anemia respond well to treatment and go on to live full lives. The clinical team has already outlined a treatment plan to help manage this condition. The first step is to start you on a medication called prednisone, which is a type of steroid. This will help suppress the immune system's attack on your red blood cells and allow your body to recover. We'll also monitor your progress closely to ensure the treatment is working and adjust the plan if needed. Does this help ease some of your concerns? Do you have any questions about the treatment so far?
Yeah, it does.
I'm glad to hear
Gosh,
that,
I was so
Tim.
scared you were gonna say like, no, this is the end of the line for you or something. I've got like kids and a young family, and I just can't imagine. Anyway, I guess I'm just really glad to hear that there's a treatment. Um, how is it if like how effective is it? Is- yeah, tell me more about this.
I completely understand, Tim. It's natural to feel scared when facing something like this, especially when you have a young family depending on you. But I want to reassure you again this is treatable and there's a solid plan in place to help you get better. Prednisone, the steroid we'll start with, is very effective for most people with warm autoimmune hemolytic anemia. It works by calming down your immune system so it stops attacking your red blood cells. Many patients see improvement in their symptoms within days to weeks of starting treatment. The goal is to stabilize your red blood cell levels and reduce the hemolysis, the breakdown of red blood cells. In some cases, if steroids alone don't fully control the condition, there are additional treatments we can use, like other medications or therapies. But for now, starting with prednisone is the first and most important step. How are you feeling about starting this treatment? Do you have any concerns or questions about it?
Is this I know like some treatments can be really bad, like chemotherapy can like make you lose your hair and have all kinds of like tough, like make you really sick. Is this like how is this? Does it have any bad side effects, or is this what's it like?
That's a great question, Tim.
Hello?
Prednisone is not like chemotherapy, but it does have some potential side effects, especially when used at higher doses or for longer periods. Common side effects can include increased appetite, weight gain, mood changes, difficulty sleeping, and increased blood sugar levels. Some people may also experience fluid retention or a feeling of restlessness. It's important to remember that everyone responds differently, and not everyone will experience these side effects. The clinical team will monitor you closely to manage any side effects that do occur and adjust the treatment as needed to minimize them. The benefits of starting prednisone in terms of controlling the hemolysis and improving your symptoms generally outweigh the risks of side effects, especially in the short term. We'll work together to ensure you're as comfortable as possible during treatment. Do you have any other questions or concerns about the treatment or its side effects?
Um, i- is this like is this something I'm gonna have for the rest of my life? Like, am I gonna have to always be on this medicine, or yeah? w-
That's
I
a
mean, I
really
guess I
important
can look this up, but yeah, if you can tell me a little more about it, that'd be great.
Of course, Tim, warm autoimmune hemolytic anemia can vary from person to person. For some, it's a temporary condition that improves with treatment, and they're able to taper off medications like prednisone over time. For others, it may require longer-term management, especially if the immune system continues to attack red blood cells after the initial treatment. The goal with prednisone is to get the condition under control and stop the hemolysis. Once things stabilize, the clinical team will work on gradually reducing the dose to minimize side effects. In many cases, people can eventually stop the medication altogether. If the condition doesn't fully resolve or flares up again, there are additional treatments available, and a hematologist may help guide long-term care. It's hard to say right now whether this will be a short-term or long-term condition for you, but we'll monitor your progress closely and adjust the plan as needed. Does that help answer your question?
So thank you. I hope you enjoyed the case. I apologize for the bad acting on my part. I think the artificial intelligence did a great job of acting like an artificial intelligence. But I hope that the case at least gave you a sense of what's possible here. Because we walked through a whole flow of, when a patient was initially presenting to the healthcare system and it asked the questions it needed to ask in order to figure out, okay, narrow things down, and then it was able to decide which tests to order, and ordered those tests, interpreted them, communicated results back with the patient, came up with next steps for a plan, and then ordered more tests, and the patient completed those, and then it was able to communicate the eventual diagnosis and treatment options with the patient, and provided education and reassurance and comfort along the way. So it did all the things that this patient needed for a workup and for diagnosis, and all of this could have been completed in a matter of days. Really, the longest lag time here would be the amount of time that it takes for the patient to get to the lab, and for those labs to be processed. As soon as those results are in, the AI can call the patient back and continue to the next step. So a process that for many people can take weeks or even months can be abbreviated to just hours to days, depending on what labs are needed and how long it takes for them to get back. Obviously, there are many, many different kinds of cases out there. Not all of them are going to be as straightforward as like order some labs, interpret results, order some medication. But many cases are that simple or simpler. So there's a tremendous amount of healthcare that can be provided just with those components: intelligence, labs, pharmacy, and the ability to talk with the patient. So this is a look ahead at the autonomous healthcare system. Who knows how long it'll be before we see that? There are regulatory hurdles to overcome. There are plenty of ethical questions to work out. But I'm excited to see how this unfolds, and I think it'll probably unfold a bit faster than healthcare has traditionally changed. Thank you again for your time and attention, and I hope that you all have a wonderful day.